I'm Dr. Carrie Firestein, Chief Executive Officer of Allied Physicians Group, practicing pediatrician for over 30 years, mother of 3, and grandmother of 1. So congratulations to everybody who is tuning in. If you're here, it's probably because you have a newborn coming into your life, already in your life in the next few months. So congratulations. It's a very exciting time. My grandson is 1 year old, so I just went through all that in the past year. I know it's also a really scary time, whether you're a new parent or grandparent, or even if you've done this before, you know, each baby brings new questions and you wonder if you remember what you're supposed to do. Well, fortunately, you've come here tonight because we're going to give you a lot of the answers that you're seeking. And more importantly, we're going to give you a trusted resource. So Allied, we are a group of pediatricians, 30 offices in all over Lower New York. And we pride ourselves on giving information to parents and being there for parents. I'm excited to announce that we're starting a new resource called a New Parent Educator or a Newborn Parent Educator. Bree's going to send out information about that in the email that you all get after the meeting. And basically that's somebody, her name is Lisette. She's lovely. She's bilingual, and she's going to help you navigate when you're looking for a pediatrician, what the choices are within Allied, what our resources are as far as breastfeeding, and even when the baby's first born, to make sure that you're getting the experience that you need out of Allied. So more about Allied a little bit later. Right now, I'm going to introduce our wonderful panel. There actually has been a last-minute adjustment, which I'll explain to you, but we're all practicing pediatricians, and Dr. Merkin, who is, also a practicing pediatrician in Great Neck, he got held up today. So Dr. Levine from Chester Pediatrics has graciously decided to fill in for him tonight. So I'm going to let Dr. Levine start. And can you introduce yourself?
Hi, I'm Eric Levine. I'm practice at Chester Pediatrics in White Plains, New York. I've been practicing for 28 years, and that generally me. I'm a father of 2 who have made it to adulthood.
Good, yay. Dr. Snow.
Yes, good evening, everyone. I'm Dr. Abarita Snow. I've been practicing for a little over 30 years now. I have a practice in Jericho, New York. I have 3 sons, the youngest of which is on the spectrum. And they're all adults, so 2 of them are out of the house, so 1 to go.
Dr. Camilleri, who, by the way, was just awarded the Hometown Hero designation by one of our local papers. Tell us about that, Dr. Camilleri.
Sure, thanks. My name is Dan Camilleri. I'm a pediatrician in Franklin Square, Nassau Pediatrics, and I'm a father of 2 exciting and challenging teenagers. So wish me luck during the teenage years, as I wish you guys luck in the newborn years. And the Hometown Hero was about how pediatricians adjusted to COVID-19 and all the things that we had to do, from wearing masks all the time and seeing patients, in the parking lot, and making other adjustments and learning something new every day in terms of adjusting to COVID, because every day was a new day and something new came along. So we can't change the wind, but we adjust our sails, and through COVID, that's what we did. So yeah, it was interesting. Hometown Hero. Thank you.
I love that. There are a lot of questions about COVID and what you do with your newborn, and we're going to get to that later in the presentation. But Dr. Snow, why don't you start us off with feeding, which is a basic newborn question.
Yes, thank you, Carrie. So first of all, congratulations to all the new parents and the ones who are expecting. It's a very exciting time, and I wish you lots of luck, and we're very, very excited to have you being part of our practice. So I see that there's some questions here on the slide. Hunger cues. If you're going to breastfeed, I suggest you start in the hospital. Try to get a lactation nurse to help you right away so that you have a little less stress and you have a better start. Newborns tend to be a little finicky at first. So just be patient and do what you can. I suggest starting out maybe 5 to 10 minutes on each side, each breast, and then burping them and seeing how they're doing. The cues a lot of times have to do with a rooting reflex. Their mouth automatically will move to the side and they automatically open their mouth, and it's easy to put your breast right inside their mouth. That's one cue. Another one is sometimes they'll put their hands to their mouth and you know that they're hungry. And the other obvious one is when they cry. You could also bottle feed. Breastfeeding is not for everyone. We love that you can and you do, but you can also bottle feed. Formula is just fine as well. How much to give? I would say, like I said, for breastfeeding, 10 minutes on each side to start, and then you just kind of increase as you see your newborn is still hungry. You try for maybe another 5 minutes, burp the baby and see if they still want more. What you do is you start on one side, you go to the next side, and the next time you nurse, you start on the side that you left off with. That way your baby will get foremilk and hindmilk. There's a lot of benefits to both. When you're doing formula, I'd say roughly about 1 ounce an hour. So if your child eats every 2 hours, they're gonna take up to 2 ounces, but that's not right away. Initially, they'll take maybe ½ an ounce. Once they get home, you'll increase it to 1 ounce to 1½ ounces. And the way you know if they're getting enough a lot of times is, but when you come into the office, we weigh them and we see that they've gained weight. But initially, you want to see that they have wet diapers. Sometimes it's difficult to see that with disposable diapers. So if you don't have the new ones that have the blue strip inside that turn color right away, you can always put a tissue inside the disposable diaper and you'll see that it's wet. They should wet their diapers maybe 6 to 7 times a day, as well as a stool. Sometimes the babies start out slow, 1 or 2 stools a day, but other times they're 6 to 7 and that's normal. They start out with meconium, which is that black green tarry stool, and later it turns to a yellow seedy stool. And that's true for breastfeeding as well as for formula. With the breastfeeding, you'll notice that it's a little more seedy. There's other benefits, of course, to breastfeeding. Babies tend to have a higher IQ. They have less allergies, less asthma. There's protection for mom against certain types of cancers, breast and ovarian and cervical cancer. So that's a nice thing to know, as well as your baby weight gets down a little quicker because your uterus contracts when you nurse. So that's another goodie. But again, formula is perfectly fine to use for your baby. And we recommend you don't change formulas unless you come into the office to see if there's some issue or there's some problem. We'd like you to continue breastfeeding or bottle feeding until the baby is 1 year of age. They should have formula, not whole milk. And that's protection for the baby. A lot of times they're not able to digest it as well. And also when they have whole milk earlier, they can develop anemia. So we watch out for that. As far as going further, when the baby is a little older, say 4 to 6 months of age, we'll help you start with some solid food. You can use organic, or you can make your own food, or you can use regular baby food. We like organic just because it doesn't have the pesticides, and we really are not sure what kind of effect it's going to have on your baby long term. So we recommend that in general. We usually start out with some cereal, but you could also start with fruit or veggies, depending on what your preference is. And everyone has a different culture. Grandma and grandpa always tell you that they started out with something and you're just fine. Well, we like to start out a little slower. I usually recommend starting with maybe half a jar of a vegetable, such as carrots, for 3 days, and then move on to the next one. That way, you know, exactly what vegetable they were on, just in case there's any kind of reaction. A reaction would be maybe some redness around the lips or a rash, or just them being cranky or vomiting. So again, you just want to go very slowly. A way to know if your baby is ready to start solid food is if they seem to be interested, they're looking at you, seeing what you're eating, or they start crying, of course, for more because they're not satisfied with the formula. What you can do is try it out with them when they're 4 to 6 months of age. You get the baby spoon and you put it in their mouth and see if they push it out with their tongue, then generally they're not ready. Wait till they're a little older, maybe a week later, you can try again. The next topic is sleep and SIDS. Babies in general will sleep, especially when they're just coming out, a total of about 8 to 12, 16 hours a day. Some babies sleep a little more than others, and that's okay. I generally suggest waking the baby up after 3 hours to feed in case they're staying longer. But if it's the middle of the night, I would let them sleep as long as 4 hours. Try to establish a pattern as soon as you can. We also want you not to have the baby sleep on their stomach. I know that was in the old days, your parents will tell you, but now we know that SIDS is a factor and sleeping on their stomach contributed to that. So we'd like them to sleep flat on their back with nothing in the crib, no mobile, no pillows, no toys around, not even a blanket. You can dress the baby in one extra layer if you feel that it's a little cold in the room. Babies can sleep in a bassinet or they can sleep in a crib, someplace close to where you are. That way it's easy for you to get them every 2 to 3 hours to feed them and to change them. Some people like to use pacifiers. We usually recommend that nothing really stays in the crib with them, not even a pacifier if you can help it. I know that some people like to do co-sleeping also. And I know a lot of times that that's a cultural thing. So I would discuss it with your pediatrician to see your comfort as well as your pediatrician. Swaddling the baby. A lot of times the nurse will show you in the hospital how to swaddle your newborn, but other times you may have a relative who's good at doing it as well. I'm sure that we'll have a video to show you if you're interested in learning how to do it yourself. Babies feel very comforted by being swaddled many times. You want to put it up on the top, but not so tight. You want to be able to put your hand in to make sure that it's not tight on their chest. If it's a little too loose, you'll see the little hand coming out for freedom. So they like being swaddled because in the wound, it's the same close quarters and they feel comforted. So we recommend doing that. I know that there are products that you can buy as well, but we think just a blanket is really sufficient. So that is my talk. Thank you.
Next up, we have Dr. Levine.
Hi, so I'm just jumping in here. So grooming babies. Just first things first, you're gonna get to know your baby rather quickly. Go with the gut, listen to what everybody has to say, take the advice that you think most follows what you feel is right, and then check with your pediatrician. But diapering, 2 types of diapers, cloth diapers, disposable diapers, many different brands. Some people feel more comfortable with cloth diapers, some disposable. You're gonna go with whatever you feel is most necessary. There's 2 theories on diaper cream. Many parents smear the diaper cream over all the time, others only when the baby's getting a little bit of a rash. I personally am a believer in the second part of only when you need it. Less is more is my personal philosophy. As Dr. Snow said before, the newer diapers have that little blue stripe that tells you when the baby's getting peeing or is wet, which is quite helpful because you don't have to undress the baby and look. I'm going to tell you a parenting tip. Point the penis down in the diaper while you're wet. If you are circumcising the baby, of course, that is a personal remember, I prefer that you put bacitracin topical antibiotic ointment. Circumcision is a personal decision. For some, it's a religious decision, but whatever decision you make is going to be fine. In our particular area, about 60% of the boys are circumcised. So either way, the pediatrician, as your uncircumcised son grows, will teach him how to clean. But either way is fine. Care of the umbilical cord. Your parents are going to come and say you got to use alcohol on the umbilical cord. We don't recommend that anymore. Keeping it clean, keeping it dry, that's the most important thing. Cutting their nails, very difficult. As my wife will tell you, I clipped my first child's finger and it bled. So careful, a little nail file, the infant nail clipper, it's hard. Many parents tend to do it when the baby's sleeping, so they're not moving. So that's a nice little helpful tip. I prefer the nail file, but you'll get to see whatever you're most comfortable with. Parents want to know about cleaning the ears. As I tell all parents, nothing smaller than the elbow should ever go into the ears. No Q-tips, nothing. Wash with a washcloth on the outside is the best way. Skincare. Bathing your baby, recommendation every other day. It is a good thought, unless of course the infant gets dirty. Many people want to moisturize. A light moisturizer sometimes is fine, but as you can hear from my philosophy, less is more. And so I prefer not to use anything. There's a big discussion on soaps. My preference is a very natural soap, like a Dove sensitive skin. And the baby soaps tend to make the baby smell nice, but don't do anything special. My preference is also a bar soap rather than a liquid soap, because there's less chemicals in a bar soap than in a liquid soap. Personal opinion, of course, but anything would be okay. I think I hit most of the topics on that, so let's move on, unless somebody has a question that I missed. When should you worry? We're parents, we're always going to worry. It's your new norm. So fever. The best way to take an infant temperature is rectally. I recommend a digital rectal thermometer. Most parents are a little bit scared. When you get to your pediatrician's office, ask the nurses, the MAs, they will be very happy to show you how to take a temperature. The thermal scans, the ear scans, the temporal scans can be quite inaccurate. So we always recommend a digital rectal temperature. In an infant under 2 months of age, we consider fever 100.5, 100.5. That's what we considered a fever. And then we recommend that you call your pediatrician before doing anything else. And that's really important because fever in infants under 2 months of age, fevers are only way to tell if there's anything going on. It could be very minor, it could be more serious, but that's our only sign that infants will give to us. So something to remember. Hiccups. Infants hiccup. It's annoying. Many of the pregnant women will tell me the child is hiccuping all the time, but was always hiccuping in utero as well. Pick the baby up, comfort the baby. It will pass. It almost always does. Okay. Sneezing. Newborn babies sneeze. Their noses have been full of fluid from amniotic fluid. They're going to sneeze initially, and it's very normal. So don't worry about that. Periodic breathing. Babies are what we call periodic breathers. Now remember, an infant breathes about 45 times a minute, which is close to 3 times what an average adult breathes. So babies always look like they're breathing quickly. And they breathe in spurts or periodic. So they'll breathe, 7 or 8 times very fast, and then they sort of stop for a few seconds, which seem like the longest period in your life. So that they may seem like they stop breathing for 5 seconds, but that's how they breathe. And you'll see their chest move up and down. I myself have watched my own infants breathing just to make sure that they were alive. We may be pediatricians, but most of us go into parent mode when we have our own. So it's very common. If you see your infant working to breathe, moving, you see the skin moving between the ribs or the stomach really moving in and out, or breathing faster than that 45 times a minute, those are reasons to call your pediatrician. Eye crossing. In newborns, their eyes will get cross-eyed, very common. And it's actually common until they're about 3 months of age. So if you're noticing it after 3 months of age, that's a reason to contact your pediatrician. They may do an eye screen in the office, or they may just refer you to a pediatric ophthalmologist for further evaluation. The quicker we find things such as amblyopia or cross-eyedness, the easier it is to correct. Visits and vaccines. Part of what we do at Allied is caring for our infants. Most of our practices, if not all of our practices, we believe in vaccinating children. And that's really important. It's really important to carry out the vaccines at the time they're recommended, because that's when they're preventing diseases at the time. So we all do the recommended schedule of vaccines. It's really important that they're done. You're protecting your child, you're protecting every other child. And as we can see with COVID vaccine, it's important that we care for everybody. In the first few months of life, you're going to be visiting your pediatric office quite often. Each office does things a little bit differently. More than likely, you'll see the pediatrician a day or two after you leave the hospital, about 2 weeks of age, every month or two for the first 6 months, and then at 9 months, 12 months, 15 months, 18 months, 2 years. And as parents say, there's pretty much vaccines at all those visits. There are other things that we're going to do, eye tests, checking for anemia and lead tests, lots of other things. But it's important to keep on schedule. It's important to carry out those visits. If there are concerns about vaccines, bring them up at the beginning. If they're, ask which are live virus vaccines, which are not. Some of our parents are on immunocompromising meds, which we need a little further conversation. But if you don't talk to the pediatrician and give us all the information, there's no way we can help you. We want the best for you, your child, and your family. All right. On our website, you're going to see what to expect at each visit. What's showing now is the 2, 4, and 6-month-old visit. They'll talk about the vaccines and screens and what's going to happen in each visit. And as your child gets older and moves more towards childhood and teenagers, there's a lot more that goes on. But go to our website. There's some great information on those visits. A bit of a plug for Dr. Firestein's videos with her grandchild on development, which are really great. I will say her grandson is very cute too, so I had to put that plug in. But there's a lot of information on our websites, and these are great informations. You can see there's lots of click here buttons on the types of vaccines, and those are good things to put to read before you come to our visits. I think, Dan, you're next.
Dr. Camilleri?
Okay, so important question, is how to choose a pediatrician. It's one of those important decisions you're going to make in your lifetime. And when I meet parents for the first time, whether it's for a prenatal visit or, in the beginning, I always like to say, in the beginning, we're going to be like close family. As the years go by, I hope we end up like distant relatives where we're just going to see your child once a year or so. So it's an important, process, doing your due diligence as far as researching, prospective pediatricians. Tonight, we're here doing this webinar. That's the first step, or one of the steps in learning about, allied physicians and allied pediatricians. Use the internet as a resource. Please use legitimate resources on the internet. As people will say, everything is true on the internet, so be careful. The different practices have websites with a lot of information about their practices. So, avail yourself of that information. Moms groups within our communities, some of those are also very good. They're going to give you some things that they like about different practices, they don't like about different practices, maybe a little bit more information, about personalities and things along those lines. So take everything with a grain of salt, process all this information. Again, everything is true on the internet. Things you don't even think about is location sometimes. Location is going to be one of those important things for a practice. Right now it's the spring and we're not dealing with snow and ice, but if you could, be within 15, 30 minutes of your pediatrician, it's great. In the winter, if you're 45 minutes to an hour away, imagine getting stuck in the snow, the ice, and with a child that's sick and or throwing up, it could be a little bit of a challenge. So that's one thing, to kind of keep in mind. We also mentioned sometimes even parking. You don't have to drive around for an hour to trying to find a parking spot. Simple things like that can make a big difference when you're trying to decide. Something like insurance. Does the practice take your insurance? As pediatricians, we take most insurances, but you always want to double check, make sure your insurance is covered by the pediatric practice that you choose and or fall, in love with. So I think those are things that you want to keep in mind. I think the best resources is word of mouth. Ask neighbors, friends, people who have children, ask them what they like or don't like about their, physician. Their pediatricians would be a great resource. You can also ask your OBGYN. They have a lot of contacts with the pediatricians, a lot of relationships with pediatricians that they know, and always be careful. Sometimes they may just refer within their organization, so you want to spread out and check out other resources as well. The thing that we probably find the most useful, and I love to do these, is the prenatal visits. It gives us an opportunity to talk with the expectant parents. Right now, because of COVID, some groups have made some changes in terms of how we meet, whether it may be a phone conversation, a phone interview, or a Zoom meeting, or still in person. With the in-person meetings, it would be, with masks, because of COVID and maintaining 6-foot distance. But it's a really good opportunity to see the layout of the practice that you may be considering going to, and it gives the opportunity then to review maybe some of the stuff you saw on the web. As far as hours of the practice nowadays, both parents are working. You have late hours for checkups and sick visits. What about weekend hours? On Saturdays or Sundays, well visits, sick visits, are you open on Sundays? How do I get in touch as a new parent, or as a parent, how do we get in touch with the pediatrician if we have a simple question or an urgent question during the daytime, at nighttime? Who's answering the questions at night? That's one of the important things that I think you really want to know as a new parent. What hospitals are the physicians affiliated with? What's their experience? How much experience do they have? And what are their credentials? I think these are all important things for new parents to question, ask, and find out. Okay. Next slide, please. So COVID-19 and newborns. So last March, everybody's worlds, changed a little bit, to the point like we've said, we're sometimes seeing patients out in the parking lot for testing and things of that nature. The one thing I do want to get across to new moms is, newborns typically don't get COVID. It's very rare that happens. Can it happen? Sure. But from the very beginning, even before COVID, we were always so careful with children less than 2 months of age to be protective, monitor for fevers, be careful who we have, visiting and things along, those lines. And, when you do go into labor and you go to the hospital, they're going to be testing, the delivering mother for COVID and taking those appropriate precautions. You can even call the hospital beforehand. I think that would be a good suggestion to see what their rules, regulations are as far as partners coming into the hospital. Depending when you deliver, right now numbers are going down. Maybe they're going to go up a little bit. Maybe we're going to see an uptick. How are those rules going to change? When things first started with COVID, partners weren't allowed there for the delivery. Right now, partners are there for the delivery. They're still trying to, get you home as soon as possible, so your time in the hospital isn't extended. When you do go home with your baby, if you are concerned, things to be concerned about, subtle warning signs would be obviously a fever, using, the rectal temperature, as Eric said, any vomiting, diarrhea, nasal congestion, coughing, increased work of breathing. Those are all little subtle signs. Maybe the child is sick and needs to, be seen by your pediatrician. With regards to COVID, newborns unfortunately cannot get the COVID vaccine. We do recommend all, household contacts, if it's available to them, to get the COVID vaccine. And when you have people visiting, we try to limit, visitors for sure in the very beginning. If you do have to have like the grandparents involved, it's a wonderful time right now. A lot of people, especially the grandparents, have had both vaccines. So if you can have that occur, that would be wonderful. And if someone close to you want them to come and see the baby, you almost want to do an interview before they come over. If you have a brother who just came back from spring break last week, I'm not sure that would be the best candidate to come visit the baby. And so again, we're going to try to limit the contacts that we have with the baby, make sure they're wearing masks and that sort of thing. So next slide is about self-care. So, when we become new parents, we think it's all about the baby 24/7. I have a philosophy, especially when you become a parent, you got to take care of the me to take care of the we. We are now a family. So really just taking care of yourself is going to be one of those important skills that you're going to have to learn. And it's sort of counterintuitive to becoming a mother or a father for the first time. I remember when my firstborn, that first night, my wife and I, that first night at home after bringing him home from the hospital, we kind of sat there all night awake. When he was quiet, we were wondering if he was breathing, and when he was crying, we were up and we were saying, what did we get into, and how are we going to take care of ourselves? But there's definitely ways to be proactive instead of reactive in terms of in terms of self-care. It's okay to ask for help. Before having children, we may have been very independent and independent-minded, not wanting help from anybody, but I think asking for help and from the extended family is going to be an important thing to do. Sleep, sleep when you can. When the baby's sleeping, make sure you're getting some shut-eye, because the first 3 months are an exhausting time until we start some sleep training around 3 to 4 months. There is a little bit of that light there that we talk about in terms of sleep training. So sleep when you can. You may not feel like you're up for visitors, so it's okay to say no to people. And if you want to, you could always say, well, no, you could use the higher authority method, which is my pediatrician said no visitors. Take advantage of that. It's my pediatrician's fault. You don't want them to think that you're a neurotic, crazy new parent. Well, you are, but it's Dr. Dan's fault. So you could use us as the scapegoat for wanting to be overly protective. And who can blame you right now, especially with COVID in the community? How many times I remember before COVID, little ones, cousins would come over and would have a runny nose, and they would just say, "Oh, it's just allergies." It's right now everything. It's not just allergies, and you don't want get that call next day that the cousin who came over had 103 fever. So just be careful, and continue to take care of yourself. As far as if you can approach the time as a new parent, incorporating mindfulness, prayer, meditation, yoga, all these things are so important to keep your mind in the game, so to speak. And here at the office, at all the Allied offices, we all do depression screenings. So if you join us, we're not just about the baby, we're about the parents, the whole family unit. So with the depression screenings, if we see that there's any signs, we're here to counsel, help out, refer if necessary. Both parents, we care about you as parents, and it's not just about the baby, it's really about the whole family unit. So we're looking out for everybody involved, for sure. Okay, next slide. All right. Well, Allied pediatricians, we are here for you. That's an understatement. I've been in practice for 20 years and with Allied for a long time, and I couldn't think of a better group to work with and patients to serve. We are a group of 30 plus pediatric practices, and kids are our mission. We're in love with children and their families. We also have a breastfeeding division to assist moms who choose to breastfeed, which is one of the best things you possibly can do. As they say, breast is best. Dr. Macaluso always talks about when babies are born, it's the fourth trimester. So those first 3 months are really a fun time, a challenging time, an exhilarating time. But to have that support of a breastfeeding division to help everybody be successful, mothers and fathers alike with the breastfeeding process is key. I forgot to mention, as far as, taking care of yourself, please, have your partner involved with the feeding in the middle of the night, especially those 2 in the morning feedings. If the other partner can be involved with the feeding and mom can get 4 or 5 hours of sleep, that's really a big help, along the way. Telemedicine, that's something I was so excited to get into, and as being part of Allied, we had already implemented telemedicine prior to COVID coming out, and how it just it really came on the scene after that. So we were well ahead of the curve and ready to use telemedicine appropriately, given the increase in telemedicine usage. So it's something to keep in mind in terms of skin rashes, breathing. Like we said, with the periodic breathing, we can reassure when we can reassure. Asthma education team takes a team approach here at Allied. We want to keep our patients out of the emergency rooms as much as possible. And I think that's what's great about being a pediatrician, is preventative medicine and keeping children healthy, preventing disease. And these things really, help our patients. We're a family-centered, children-centered group of practices who love kids, and that's Allied. We look forward to hopefully everyone listening becoming part of the Allied family. So thanks for listening.
Thank you so much. So I went through a lot of Q&A as people were talking, and I think everybody gets a copy of all those when we send out the video. But a few things that came up that are absolutely worth discussing. Dr. Snow, what's your recommendation about someone who is breastfeeding getting the COVID vaccine?
So far, as we know, there's no contraindication to getting the vaccine if you're breastfeeding. I think there is a problem when you're pregnant that I know the AAP is against. But as far as breastfeeding goes, there hasn't been any contraindication. So you can breastfeed.
Thank you. I actually wasn't aware that the AAP, because I know the American College of Obstetrics and Gynecology is recommending that pregnant women get the COVID vaccine. Dr. Well, did you want to?
I thought that I had just recently heard that they had said not to get the vaccine for now, but there wasn't enough evidence.
The latest studies are showing that women who got the vaccine in their 3rd trimester, the infants are being born with antibodies to COVID.
So that's good, right?
Okay, so
It's
So
very
that-
good. I mean,
yes,
I think it's a very difficult decision for a woman to make, and we're here to support whatever decision you made. But these are the information that's coming out. It's all so new,
right.
and the information on breastfeeding, that when a mother gets the vaccine, we are seeing antibodies in the breast milk. Testing breast milk is a very difficult process, but we are seeing the antibodies in the breast milk. How the infant is absorbing these antibodies, we have yet to determine, but there's always that great possibility that mothers are passing along these antibodies. And we know it happens with other things, other illnesses in breast milk. So it's hopeful. As Carrie knows, I get my information from a very reliable source.
You want to share that source with us?
My daughter is a virologist who studies respiratory RNA viruses, and actually will be starting researching COVID drugs in the summer.
Yeah, so it was a very timely thing for Ally to have our own expert. But I can tell you that, the worst thing for a baby, whether it's inside the mom or outside the mom, is for mom to get sick. And we unfortunately have somebody in our neighborhood. We have a mom of 2 who's pregnant 5 months and is in the ICU with COVID. So I would, make sure you discuss that with your OBGYN and follow their advice. I can tell you that we've had a lot of questions from parents of teenagers and young adults about getting the COVID vaccine and fertility in the future. And there have been no studies. There is nothing that indicates that the COVID vaccine will interfere with that at all. And, to me, it's one of those trite things that the anti-vax community pulls out every time something new comes out, because it's somebody's greatest fear, right? That you're going to interfere with their fertility. You can't prove that because it's going to be years from now. So there is nothing about this vaccine that would make anybody think that. And it's also, if you don't survive to have children, it doesn't really matter what's going on. And unfortunately, thank God, most teens and kids are doing well, but the risk of something happening in the future is tiny. And we are seeing, young adults who are getting really sick. So speaking of vaccines, Dr. Camilleri, now that everybody is masked and not really going out that much, would it be okay to alter the vaccine schedule or delay it a little bit until the baby's really being exposed to more people? Would that make more sense?
Well, I think we're old enough now where we remember some of these illnesses before vaccines, and it's pretty scary, I guess, for the pediatricians who've been practicing a long time. So you never know when there's going to be, sort of like another outbreak. And one of the things, I keep thinking about is, this year and next year, I think we're going to be pretty healthy. Everyone's wearing their masks and everything else like that. But I think, a year and a half from now, once, we start taking the masks off, everyone's immunity is going to be down. And, I think we're going to become vulnerable to those infections that we're so used to having seen previously. So I think, really getting vaccinated is one of those things that really saves lives. The pneumococcal vaccine, I knew when that came out, Prevnar, 20 years ago, how it changed the way we manage fevers. And to have a child in the hospital, an infant, with the whooping cough, that just it's unnecessary these days, given the fact that that we have vaccines.
Yeah, and I don't know about you, but I have kids coming in, toddlers and infants coming in with fevers, and the parents swear they never went anywhere. Right. So they got sick with something somewhere. So, the best thing to do is follow the vaccine schedule as created by the CDC and the American Committee on Immunization Practices, because that schedule has been tested millions of times, whereas any schedule that you come up with on your own or you read in a book has, maybe been used, maybe been tested, but most likely not. And, you think you're doing your child something better, but if it's never been tested, you really don't know that. Plus, a vaccine delayed could be a vaccine denied, right? Because then the kid gets sick, or there's another outbreak and you're afraid to leave the house, or just you never know what might happen. And then the child isn't vaccinated. When you push one vaccine off, it often pushes other vaccines off. And that can be an issue, right? And, as careful as we all are in our offices, when you stray from the standard schedule, there's more likely to be an error where something's forgotten or given a little bit too soon, even though the computer's supposed to warn us when that happens. The best thing to do is to give vaccines on schedule when they're due. Dr. Dan, while you're on screen, you mentioned when people come to visit the baby wearing masks. If grandparents are double vaccinated and feeling well, do you think that's still necessary or a good idea?
Yeah, definitely. I would still wear the mask. Right now we're seeing all these different variants, and I keep thinking, like, coronavirus, common cold, it's changing. Changes rapidly. So I think especially with some of the vaccines being 95% effective, maybe that gives you a 5% chance of it not being effective, theoretically. So especially with the newborns, especially in the first 2-3 months of life, yeah, without hesitation, I'd still wear the mask, even though vaccinated around the baby. Again, before coronavirus, I always said, we always said, take those extra cautions, because it's a burgeoning immune system, and the last thing you want is a baby that's 1 month, 2 months old, sort of a virgin immune system to come down with the virus. I mean, the feeling of guilt would be just too much to, bear, so to speak. So your thoughts?
A little caution. I think we've all learned the masks aren't so terrible.
Right. I think it's amazing how the little kids have even just gotten used to it. When these little 2-year-olds are wearing it the whole time during the exam, and some of my children on the spectrum too wearing it. I'm so amazed how it's just become, commonplace now that everybody's pretty comfortable with it.
Yeah. Dr. Snow, there was a question about spoiling the baby. Do you think that, with your little infant, if you hold them every time they cry, is that going to spoil them?
I think that the baby needs security, and I think that you're a precious one. You should hold it and kiss it and do everything as long as you want. I think that there isn't a chance of them being spoiled until they're much older, say 7, 8, 9 months old. But when they're little, that's the way they communicate, and they need that reassurance, and they're calling you. So what you do is you obviously go to them, you tell them everything's okay, and you hold them. I think it's fun. I don't think you can spoil them so early, no.
And you talk to them. I love that, right? From the beginning, just talk to them.
Yeah.
Dr. Levine, can you talk to us about colic? How do you know if your baby has colic or is just fussy or has gas, or what does all that mean?
Colic is recurrent crying for a certain period of time, usually around the same time of day. It's almost always in the middle of the night. And it's a difficult thing to say. Many parents will tell you, my kid had colic, my kid had colic. There's lots of things that look like colic. It could be reflux. It could be an allergy, not an allergy, but a reaction to the formula. It's something that you want to talk to your pediatrician about. There are things that we can do. There are herbal things that are good things to try. I'm a firm believer in some of them. I'm not in others. But if you are trying them, it's really important that you talk to your pediatrician, because they may want to try a different medicine, and we need to know whatever you're giving your baby. It's not harmful. Will make every parent crazy. There's lots of tricks. And if you go out at 3 o'clock in the morning and you see a car driving around, you can guarantee you that is a colicky baby. And by the smiles I saw on everybody's faces, you can see we have all been there.
Dr. Camilleri, speaking of driving around in the middle of the night, sleep training. How soon can you start training your baby to sleep through the night?
It depends on the child, as long as it's a full-term child and, not premature or anything, I always like to say around like 3-4 months, 12 pounds. I'm a big believer in Operation Ferberization, following Dr. Ferber's concepts of the sleep training. And I tell people to take on their own different approaches and make it their own, as far as the sleep training. I'd love to see kids, sleeping through the night by 4 to 6 months and giving you 8 to 12 hours through the night. And you could start as early as 3 months, and even around 2 months, I'll start just, establishing those nighttime routines, because I know a lot of moms are going back to work at 3 months. So just, I always say, sing the same song, read the same book, breastfeed, bottle feed, and, put the baby down, in the crib or bassinet. And just establishing those nighttime routines just really sets like that mental cue for them that it's, it's sleep time. Dim the lights, limit your arguments with your spouse to a minimal roar, that kind of thing. Really helps a lot with the sleep training and just associating that time with, going to sleep. So yeah, anywhere from 3 to 6 months, we could definitely get things going and get these kids sleeping through the night. The firstborn, really tough, because they really pull at the emotional strings. The secondborn, you're like, hey, been there, done that. I am not staying up with you the rest of the night, kid. I did that with your brother and he's still in my bed at 16 years old. So, hey, the secondborn, that's it. You're sleep training yourself and we can get them, sleeping through the night. So that's, kind of the time when we start with the sleep training for sure.
Thank you. Dr. Levine, formula. Do you recommend a certain brand or type?
My recommendation is to start with a milk-based formula. I choose to say it's like Coke or Pepsi. They're all good. Similac, Enfamil, Walmart, Costco, they're all FDA approved formulas. There is a push in some circles about a particular formula that is shipped from Germany, that is all organic and is $25 a can. It's not FDA approved. It has never been checked by our watchdog agencies, so to speak. There's no need for it. The major formula brands make organic if that's something that's important to you, but any of the milk-based formulas to start.
And do you have to use distilled water or boil the water, or what do you do?
What I tell my parents is if you drink your water, use your tap water. If you're mixing powder, I would boil the water, not for sterility's sake, but it mixes better. If you don't trust your water, bottled water, your Poland Spring cooler is absolutely fine. You don't need to buy distilled water.
Excellent. One thing I want to add, there's a product out on the market called the Baby Breeza, which is like a little Keurig machine for formula. And I've had patients that love it, but I recommend against it because there have been some cases where, there was a little too much water or a little too little water. But if it's every feed every day for months and months, there have been babies hospitalized with sodiums that are too low or too high, even causing seizures. So that's one of those things where I would just stick with the mixing yourself, because even if you're off a little bit on one feed, you're not going to be off consistently feed after feed after feed.
I also recommend do not microwave formula.
I'm actually okay with microwaving a little bit, but you just have to make sure you shake it and that there are no hot spots in between. But I'm a little lazier than you are, clearly.
This is why they call it practicing medicine. Everybody brings a little something
Exactly.
to the table. And that's how it is in a group. So anyone, when you join a practice, you may hear one thing from someone and something else from somebody else. There's no right or wrong. It's just practicing medicine.
Yes. And sometimes patients get confused, right? But, and somebody here earlier in one of the posts said, I heard you should keep the baby upright for 30 minutes after you feed, but someone else said 15 minutes after you feed. There's no right or wrong there. The other thing to realize is sometimes things also change. What's the right advice when your baby is 1 week of age is not the right advice, when the baby's 1 month of age, and that might change. So it's not necessarily that we're giving you different answers, but the baby has changed dramatically in that short period of time. We have time for one more question. We have a question about tongue tie. Who wants to take that one? Dan, you want to do that since you're on camera?
Looking,
We're all on camera.
leave it alone majority of the time, unless it's really, affecting breastfeeding, then we can always, refer to someone to have it taken care of, especially if it's painful with the breastfeeding and things along those lines, for sure.
Yeah, so someone also asked that question about painful breastfeeding. So initially the letdown and, your nipples are not used to being used in that way. There can be some pain, but if you're feeling a lot of pain in breastfeeding, that's a reason to check in with Dr. Macaluso, your pediatrician, our lactation consultants, all of that.
Can I just say something about
Go ahead.
tongue
Yeah.
tied? I've had a couple of patients who they came to me, it was recommended by a lactation consultant to fix the tongue tie. And I referred them to Dr. Macaluso, who by telemedicine worked with the mother, and the child never needed the procedure. And it's my plug for Dr. Macaluso. And I'm in Westchester and she's in Nassau County. And she is just wonderful. And if she tells me that the child needs to have the tongue tied repaired, then I will believe it. But really, before you do a procedure, even though it's very minor, there are always potentials. Check with your pediatrician, check with Dr. Macaluso. Even if you're not using an allied pediatrician, which you shouldn't, you should use one of us, but you can use Dr. Macaluso even then.
Yeah, and I would say that, all of us have been practicing a long time, and tongue tie has become, in favor in the last 5 years since lasers got, obtained by some of the practices in the area. And I can't imagine that there's really that much more tongue tie than there used to be. So for the most part, it's definitely overdiagnosed. Okay, so we're coming in on 8 o'clock. I want to just talk to everybody for a brief moment about all the resources on the Allied website. It's recently redesigned. It has a great question feature or search feature. How can I help you? We have lots of great information. The baby basics, which are all my videos. We have all of these videos that we've done over the years with different pediatricians. So if you're looking to go to one of the other groups in Allied and you want to check out one of those doctors, you might find that we've already done a baby webinar with them. There's also some COVID webinars, lots of great blogs. We're going to send out all of that great information, including how to get in contact with our new newborn parent coach. And that's all going to be sent out to you in the next day or two when they're able to make this video. There was one last question about warming formula. Most of the time we warm formula because if you think of breast milk, it's 98.6. So you do want the formula to be a little warmed, and that's how baby is used to getting it. I want to thank all of our panelists. As always, I learn something every time I sit with you guys, a different group of 3, and just hear how you practice. I love to hear how you talk about what you say to your parents. When you're there in front of you, you can clearly hear that some of this is stuff that you've repeated over and over again. And some of it, like with COVID and telemedicine, is stuff that we're learning. And, I appreciate that you all gave your time here tonight. So thank you, everybody. Thank you, Bree. Thank you, Allied, for setting this all up. And everybody have a great night and good luck with your newborns. We hope to see you in an Allied office soon.
Thank you.
Good night.
Bye, everyone.
Bye.
Thank you.
Thank you.